You know, a lot of people struggle with pain in the neck and in the back. So we have Dr. Jim Blanton here from Blanton Chiropractic with one of your patients, Desiree Stowers. So welcome. Great to see you.
You too.
So let's talk about it. I feel like this time of the year, more than others, we're all very stressed everywhere, but sometimes it's a more serious situation. So what did you bring with you?
I brought a lumbar spine, and what we're going to be looking at and talking about today are disc.
Okay.
So when we look at this, what happens is when you get compression on those discs, then the disc can bulge or herniate or protrude, which people that have had those problems, whether they've had x-rays or MRIs, they'll see that on those. Yes, and it can be very, very painful.
Is this what you had?
I have. I've actually had several back issues. I've had a couple back surgeries. I've had some disc bulging. I've had a herniated disc, and I'm really worried that, you know, in the future that I may have to have another surgery, and I'm trying to keep from you know, that happening. So I've talked to Dr. Blanton about, you know, what I could do.
Yeah, some other options there.
Yeah.
So what do you do for people who say, I've got this excruciating pain, but I really don't want to go through surgery?
So what happens is different people have tried different things, whether it be regular chiropractic or physical therapy or exercise or whatever. So the non-surgical option that we have, and we're looking for people that either have bulging herniated disc, or they could have spinal stenosis. Maybe you've been diagnosed with that. Many different things that have they've not got great results with. So what we do is a new technique. It's called spinal decompression. So all of our regular adjustments we do are more on this plane or this axis, and so we're trying to get this spine to decompress. So we have a special tables that have straps that they strap in the upper body, and then the lower body is attached to a computer by a cable or cord. And so what it does is, instead of the spine continue to be compressed and that bulged or herniated disc there pressing on the nerve, then we're trying to get it decompressed. So we always say millimeters, not inches. We don't have to pull it all the way apart. But if we can just get a little bit more space in there, then the results can be amazing and a little bit mind-blowing. So for people that haven't got results from anything else, and of course in this area, we're trying to keep people from drugs as well. So whether it be prescription or non-prescription, because they're trying to find anything for pain relief. And so the results are really amazing for the people that we can help, that have enough space in there for us to be able to help.
Well, how's it going so far?
It's going really good. You know, when he was showing you this, you know, I've had a lot of pain that shoots down my hip, and, you know, my lower back hurts a lot. And when he straps me into this machine, it really feels just like a gentle tug. It's nothing, you know, nothing hurts or anything. It feels great. It feels like a good stretch. If you're going to like arch your back really well, it opens that space up, and that's, you know, what it's intended to do. It just creates that space so that those bulging discs that I have has the opportunity to go back into place where they should be.
They're supposed to be, right. How soon before you started noticing some relief?
Within a couple months or so of getting treatments. I was getting treatments starting out a couple times a week, and the longer that I've been getting these treatments, now it goes to once a week, once or twice a month, and I'm kind of just maintaining right now.
Oh, wow. And that's probably what you want to hear from a patient.
That's exactly what we want to hear. So we got to get those discs pumping. And so you're pumping the bad toxins out, getting the good fluids back in. So what we're doing right now, we're offering a gift certificate that gets you full x-rays and an orthopedic test and full exam, so that we can see what's going on and see if you're an option for this kind of treatment, and see if we can help. So we're offering that $49 gift certificate that's on the screen. Just give us a call, and the girls are at the office right now. They're waiting on your call. We tell people, you know, just because you haven't got results from other ways or other ways of doing things doesn't mean that this might not help, because we're mechanically getting the pressure off of those discs. So.
Yeah, you don't have to suffer and think, well, this is just the rest of my life, what I'm going to go through. There's actually relief. So this is very refreshing to hear that there are some other options out there. And again, you said right now might be a good time to give you all a call and see if this is right for you.
It's a great time, and you know, we're booked out for a month or two. But if you call now, you can get in and get an appointment for January, February.
Yeah.
So to really get it checked out.
Wonderful. Well, Dr. Blanton, Desiree, thank you all so much for stopping by and sharing this with us.
Thank you.
Thank
All right.
you.
We'll be right back.